is important to be specific when describing your symptoms and how these affect your daily life.
A few weeks after titrating off one of my PD meds, I told Cindy that my gait had become awkward, I felt unsteady, and I could no longer walk even one wing of the mall without having to rest. The mall is my mountain. Born to shop, this had me feeling very depressed.
And one thing was for sure, I did not want Sheryl to lose her ability to do what she was born to do. In this case, after talking about the reasons why we decided to stop the medication, we decided to actually restart it since she really did miss it. Sometimes this is the only way to determine if a medication is of benefit. One of the worst things is to continue a medicine, however, that doesn't offer any benefits. Then one ends up on yet another medication in the mix, and sometimes patients can end up taking mountains of pills, as I'm sure many of you may have experienced.
Do not leave your doctor's office with unanswered questions or without knowing what to do next. If the doctor makes you feel rushed, let him or her know it. If you are unclear about the prescribed course of treatment, what outcomes to expect, or even the meaning of a word or concept, ask your doctor. I always do.
What I failed to take into account with Sheryl is how differently people with different personalities hear what I tell them. Perfectionist that she is, Sheryl dove headfirst into the murky abyss that is the World Wide Web and almost drowned.
Now, I'm not a hypochondriac, but I do admit to being ailment obsessed. A condition that leads me to go online to read up on every new symptom I notice and then self-diagnose. Inevitably, I find another incurable but much more rare disease that I'm certain I have.
The stress caused by this process is a slippery slope because worrying can make existing symptoms worse and even create some new ones.
Fortunately, Cindy and I have an inexplicable telepathic connection that has her appear out of nowhere when I need her most. Take the morning I was researching autonomic nervous system dysfunction, something nobody should be doing before breakfast, and convince myself I had multiple systems atrophy. Why? Because I'm always hot. And that couldn't just be the most common symptom of menopause. Surely it was something worse than that. I was about to swallow my anti-anxiety medicine when I heard a ping on the computer indicating I had mail. It was from Cindy. Oh good, I typed back. Now I have you to talk to instead of taking my medicine.
After discussing this with Sheryl, I told her, I can assure you, you do not have multiple system atrophy, and that in fact you're doing very well. I also told her you really don't need your anti-anxiety pill.
Her reassuring bedside manner enabled me to put these worries out of my mind, at least until our next visit. If a little knowledge is good, a lot must be better. I grew addicted to the internet quickly. I sat at my computer night and day, reading everything I could find about Parkinson's, failing to distinguish content posted by legitimate experts and institutions versus by patients who may or may not have been accurate in what they were saying. My husband would awake in the middle of the night to find I had gone AWOL again. He would go straight to the computer where I would be sobbing in the glow of the monitor and patiently coax me back to bed.
I tried to win Sheryl's agreement to limit her time online and restrict her access to legitimate internet signs, but she conceded nothing.
I was angry that my husband tattled on me, even though I knew he did it for my own good.
Sleep disturbances, which could be part of the reason that Sheryl was online, are common in people with Parkinson's disease. Many people report that if their sleep is poor, their symptoms seem worse. This is what we would expect as the brain recharges its dopamine overnight. Most people find that a good night's sleep leads to a good day with Parkinson's. I encourage patients to practice good sleep hygiene, but they don't always listen.
Okay, we know she's talking about me. I have no problem falling asleep, but after only 3 or 4 hours, I awake feeling rested and clear-headed. So after a quick bathroom stop, I sit down at my computer and start researching and writing articles, doing a little online shopping, or playing bridge or Scrabble with others around the globe, where it's light and morning. I lose all track of time until I see the first morning light streaming in through the window, and then it's too late to go back to bed.
Good sleep hygiene involves, when you're having difficulty staying asleep, to get up, to spend 20 minutes up, but not doing interesting things like finding the ends of the internet, but rather something that you find dull. And then after 20 minutes, one goes back to bed and tries again. This is a process that can be repeated throughout the night, and sometimes is actually more effective than medications we give as sleeping agents. Even in the best doctor-patient relationships, there can be conflicts. These often result from miscommunications or a short amount of time that the doctor has to spend with each individual patient.
I have been to doctors where the exam is over before I know it began. Their hand is on the doorknob before I could ask my first question. This doesn't happen with Cindy.
A doctor, however, is given only so much time to see each patient, but providing good care sometimes does require more time. I feel badly for patients who are waiting in the waiting room for their appointments, but sometimes there's just no way to catch up.
Other patients who may feel rushed when their turn finally comes think to themselves, I waited half an hour and now you're trying to get back on schedule? You're not even listening to me. You keep interrupting. How can I get to the point? You told me that whenever I remember something important, I should tell you. So I am. But you don't leave enough time for questions. Not Cindy. We're just
it's a tough situation. I think that most patients do understand, however, that one day they may also need extra time. So I have found, in fact, that most patients are very patient with me when I run behind schedule.
If you want to have a good relationship with your doctor, you should remember that doctors are people too, and fallible like the rest of us.
Communicate concisely about important medical aspects of your care, saving additional questions for others.
Ask for clarification if you don't understand something.
And as we've already highlighted, avoid self-diagnosis.
But do report any adverse happenings. Okay?
Sometimes it's difficult to reach the nurse. So if one could focus the questions that one has when calling the office, that can be very helpful in managing Parkinson's disease.
Questions like, what is this rash on my arm? And should I change my blood pressure medicine? Are best handled by the primary care physician. After all, you wouldn't ask a urologist to change your Parkinson's medicines, would you?
However, if you experience adverse effects of medications or feel something isn't working for you, call immediately. Sheryl is one to search the ends of the internet for answers and then wait until her next visit to ask for my opinion about what she's learned. Sometimes I wish she'd just close the internet and give me a call.
That'd be too easy. But you have to admit I've made progress in this area. When I felt like I needed to get off one of my meds, I asked you first.
That's unusual. No, I'm just kidding.
We hope that you leave here understanding that choosing the right doctor to guide you on your journey with Parkinson's is essential to living well. And making this relationship work requires that we recognize that doctors are people like us and that they must see us as individuals and not bundles of symptoms. Remember, we all put our pants on the same way, one leg at a time, except those of us with Parkinson's often put two legs in one opening. So we just want to thank James and the Northwest Parkinson's Association, APDA, and NPF for having us here today, and all of you for staying until the end to hear us speak. Thank you.
As far as communicating with your doctor with a phone call, what about a fax? You can have the questions in detail.
You know, sometimes fax is a good way to be, not everybody has access to a fax machine, but sometimes fax is a good way to communicate. Email, on the other hand, there are many hospitals that do not have encrypted email systems, which means that physicians are not permitted to provide medical care via the internet. So all we can do is like give you sort of general stuff, and then we have to transfer it to the nurse to get the chart pulled, etc. But fax sometimes is really quite nice because you can write everything down that's bothering you.
I saw you last year, Sheryl, and I thought you were so funny, but I think today you even did better.
She really is the funny one in the group. I'm the straight man. She's the funny one.